Welcome in, everybody. I'm Dave, and this is Danny, and together we're D2 Educational Consulting. This is episode 3 of our first series for growth based grading for nursing education. And in this episode, we're going to be talking a lot about feedback, about walking the walk when it comes to feedback. So, our agenda for this is to go over our norms and guiding principles as we always do to start.
Mhm.
Then we have a little bit of an anticipatory set. We're going to really dwell a long time on actionable and mastery oriented feedback. We'll talk about how to align in some of the pillars, and then we'll explore some of the ways that feedback is being currently implemented and maybe look at some shifts that we can make here going forward before we reflect and close.
Exactly. As we're going through today's session, everybody feel free to pause at any time that you would like to, rewind, fast forward, to really sit with the content as you need to at your space.
So, like I said, we start with our norms and guiding principles to start each one. So, we start with the Harvard Medical School's governing assumption that we believe everyone participating in our activities is intelligent, capable, and cares about doing the best and wants to improve.
Yeah, and we remember everybody that at all of our sessions, we want to make sure that we're present, participating, and producing learning artifacts. The who is more important than the what. Grades are temporary and skills are forever. No one is here to be a bad educator, and we're a community, so we're going to respect it and each other as we're working together today.
So, some of our session goals here to start is we're going to really identify and connect with what the feedback tools are with growth based practices and connect some of our current practices that
Right.
we have here too.
Right, because remember, and we're going to really kind of explore some of those classroom artifacts of feedback and assessment to really kind of realize everyday practices that are currently going on and implementation routes to growth based grading. Because as Dave and I love to keep coming back to, it's really not all that different than a lot of the practices that we might already be doing.
And then we'll end a little bit by reflecting on some of the similarities and differences between growth based grading and some of the traditional grading practices that we see. So, in order to realize growth based grading, we really have to look at some of the shifts that AACN has highlighted here for us in the new essentials. And so, we are really looking at the way that they are calling on programs to shift and work with competency based framework and really support skill acquisition in this dynamic field that you find yourselves in.
Exactly. And one of the things that we're going to be diving into really today is feedback, because feedback is one of the best tools that a lot of us have to create growth within skills and competencies for our students.
So, after all that, officially, welcome. Thank you so much for being here today. We're looking to go maybe about 30 minutes with this, and obviously, you can pause and reflect as you need to.
And we've got a few of those points throughout the session, and this is one of those reflection points. So feel free to build in a pause for yourself here. But just getting started, thinking about feedback for yourself, your current context, the way that you're giving and receiving feedback. How might you describe the current state of feedback in your learning environment? What's it like for you, right? That's a great way to start yourself into that reflection mode.
Yeah, and then once you sort of think about that, we really want to think about what's the application of the feedback. What does that application process look like? How is it received, and then how is it transferred?
And we also want to think about the barriers that we face when it comes to feedback. We know that time is a barrier. We know that resources are a barrier. So we want to kind of think about those as we're working through the session today as well, and how maybe some of these tools might mitigate some of those barriers.
And ultimately, we really want to think about the purposes and the goals that you have for feedback and what you want students to do with it. What would you do with the feedback? And then what should they do with it as well? So take just a moment and reflect on that, and then we will go ahead and move on.
So we're going to start today, everybody, by really thinking about what is growth-based feedback. And in order to explore the idea of growth-based feedback, we're going to focus on the concepts of alignment, actionable, and tone. We want to make sure that tone is encouraging and realistic for our learners. And so we're going to kind of dive into all of these concepts here as we dig forward.
So let's take a look at the big picture to start. So, like we said earlier, we're really looking to align to the skills and competencies outlined in AACN. Where do we see those through lines? Where do we see where we can really implement skills and competencies over tasks and behavior? And how do those skills and competencies apply universally,
Hmm.
not just in nursing practice, but maybe also in the didactic classroom, maybe in the clinicals, maybe in a lot of other places that we haven't thought of here as well.
Yeah, and we want to also, through the feedback that we're providing to students, we want to build students' capacity to really understand and use the course language in the same way that we understand and use the course language, because that's going to have them. Let them get to a deeper understanding of the purpose of the assignment or the assessment that they're completing and the purpose of the feedback that they're also receiving. And you're going to see that application of the feedback a little bit more if they feel like they can use it.
And so some of the ways that we see a path to alignment would be through that feedback and really making it actionable and achievable.
Mhm.
And so, in order to do that, we have to be explicit on what we want students to do. We have to really use the language of the skills in order to make their learning accessible to them.
That's a great point, Dave. And we really need to make sure that we're also showing them within the assessments and also in the pathways to the next assessment how that feedback is transferable, how they can take this and use it for the next time. Because every time that they complete an assessment of the same type, it's a new chance for them to show those skills and to show that growth in those skills.
And the last thing we really want to do is make sure that we're driving students to the feedback as their primary form of improvement. Too many students get something back and they file it
Yep.
away, or they look at the grade overall and don't really look at that feedback because maybe it hasn't been actionable and achievable in the past.
Right, right. Dave, I think this is a great moment for us to kind of pause and think about what this looked like in our learning space when we were doing this in our classroom. And so, what did you sort of notice were some of the shifts that we made in terms of our feedback and the way that we wrote feedback as we started making it more mastery and growth
The
based?
biggest thing that we did was shift to the skills and the competencies
Yep.
of the language and making sure that we were talking about in the English language classroom, talking about claims and evidence and talking about reasoning and organization and talking about style and central idea and really using the language of the course and showing students how we were coding our assignments and
Yeah.
how and where those different things would play into as they were either working through tasks or writing.
Yeah, exactly. And again, like they also were able to then the value of the feedback went up a lot for our students, and we saw them using and keeping as opposed to just throwing things in the recycling bin. That those artifacts became so much more valuable to them when they saw that they could use them.
Exactly. So, as we look at feedback and strategies to change and shift in feedback, the one thing that really is controllable and easy for us to do as individuals is to control our tone.
Yeah, and that's a huge point. And we also want to I want to take a quick moment and remember too that feedback can exist in a variety of formats. It can be spoken, it can be video recorded, it can be written, but no matter the format, the tone is so, so, so important. And so we'll want to make sure that we're kind of making sure that we are realistic, encouraging, positive, but not toxically positive, not falsely positive. That objectivity is a really important part of this as well. And again, using the language of the course and the language of the skills and the competencies really is a tool that can help us to do that and to show them, the students, that there is an objective standard. I'm not being mean here. This is just what mastery looks like. And this is where you are in relation to that, right?
Yeah, because this is a complex field and there are lots of nuances to consider in here. And so, in order to do that, what we should do is we should take a look at previous examples and
Hmm.
look at where they might have scored high and where they might not have scored high. And where can we focus on as educators and as students in order to really make sure that we're getting the most out of these things that we know what we're looking for when we are creating our artifacts and what our professors and instructors are looking for when they are assessing those artifacts.
That's right, Dave. And we want to make sure that throughout all of that, that we're also encouraging. We want to make sure that that encouragement exists throughout all of the structures of the course and the way that the course sort of speaks to the student, the way the assessments speak, the way the grading speaks, all of those things send messages implicitly and explicitly. And we want to ensure that and show that there is a pathway to mastery. There is that pathway forward no matter what at all
Well,
times.
and that's what I was going to say is that the language of the course, coupled with the encouraging tone, really shows students that there are multiple paths
Hmm.
to success, that there's lots of ways to be excellent, and that no one has to be perfect because there's always room for excellence in there. And what it also does is it becomes a partnership between the instructor and the student
Right.
in order to get the best scores possible, in order to demonstrate the highest level of nursing competency possible,
Hmm.
because it's not me versus them, it's us understanding what AACN is asking us to do. And so then it doesn't become about who's right and who's
Yeah.
wrong.
Yeah. We're beyond the gotcha. We're beyond the fear of feedback. That's really what this kind of becomes. Even when we have to have really kind of harsh conversations, when we have to have those moments with students, we can still, again, use it and frame it in a way through those standards and through those objective standards that really allow us to build that pathway together.
So one thing I will say is my tone when I was giving written feedback when on writing was not always the best.
Mm,
I would give comments or I'd write a question mark in the margin, and students really didn't know what I was trying to communicate to them.
right.
But then when I shifted to more of the conference based model where I
Hmm.
said, hey, listen, let's sit down and do this together, then all of a sudden it didn't become me in some dark room somewhere grading things with a red pen and talking about how much I might dislike that student, but instead it was like, I'm confused by what you did here, please help me to understand it. And that shift in encouragement and positivity really made a difference for me in feedback for my students.
Yeah, and exactly. And I think also too, when we think about the way that we can just continue to show and continue to give that encouragement as we're moving through a course, right? We got to remember that when they're just starting off, right, versus at other later points when we are expecting more from them, the conversation can shift and the tone can also shift to kind of be what it needs to be when it needs to be.
Exactly. So we saw some really positive outcomes with this actionable feedback. For the students, really, we felt like we were able to develop individualized feedback for them over time. If
Hmm.
I knew a student was going to struggle with reasoning and organization, I knew that I could focus my feedback there. And then once they had gotten better at that, it allowed me to see paths of where they might need to improve in
Hmm.
other areas.
Yeah, and it really, again, allowed us as instructors to have the conversation that we needed to have with the student when we needed to have it. If we had a student, for example, that was really having trouble with thesis, with one of the most essential elements of writing, we needed to make sure that conversation was had before any other conversations were had to
Mhm.
lock that in. And so that's a place of reflection, perhaps, is to consider how through this action and focus and this standards oriented feedback, we're also able to be more efficient with our feedback and able to be more targeted with the feedback to drive the student back to the feedback. We're also talking about de-weaponizing the idea of being wrong, right? It's not about being wrong. It's about making a chance to improve, making a chance to grow, not doing that again because of that idea of learning and growth over time, which is what we're rewarding and what we're incentivizing
Exactly,
here.
because we know that students are going to have to do these tasks again, that
Hmm.
this isn't just an assignment in isolation. And so like we said earlier, we're trying to drive them to the feedback, and it becomes feedback as a tool, not feedback as a punishment.
Right.
It's not something where, again, where we're trying to hurt their feelings or trying to express something else besides this is what you need to do to learn and grow. And so that takes us from an antagonist, maybe in the past, to more of a partner now.
Or they feel that we're an antagonist to them. They feel that we are beating up on them through that feedback. And then they don't use that feedback. And again, like their impression of our intention is really what matters, right? What we intended to do doesn't really matter if that's
Mhm.
not what the result or the impact is with them. We also want to consider, again, for us as instructors who have so many students to give and apply feedback to, we want to consider the way that we are targeting our feedback and we're really telling them what they need to do and how they need to do it. So less is really more because they're going to do it again. They're going to keep doing it and keep showing us so we can just give them the feedback that we need to give them right now.
Exactly. And by driving them to the feedback, we see so much more growth and change in students overall. They start to speak the language of the course. They
Hmm.
start to crave that feedback. They start to conference with their peers in there as well. And it just really makes it more of a learning community.
Exactly. And also, your edge cases on both sides of the equation are going to stand out a lot faster for more intensive intervention, perhaps if they're on the lower side of the scale, or for enrichment and leadership opportunities if they're on the higher end of the scale, which again, then we have the students acting almost as co-professors, as co-instructors with us to drive more learning for their peers.
Yeah, and that consistent language, like we said before, it just allows students to internalize the language of the course. And then once we're all speaking the same language, then we can really have some efficient practices. Again, it starts to become about those skills and about those competencies and not about the task.
Exactly. All right, everyone. So, next, what we're going to do is we're going to take a look at some examples of feedback, and we're going to ask ourselves three questions as we look at these pieces of feedback. Is it aligned to standards language? Is it actionable? And what's the tone like? Is it encouraging? So, let's dive in.
Because if it does all of those things, it is probably growth based.
Growth based feedback.
So here's our first example. It says, worked in the nursery, helping blank and blank with assessments, meds, and feeding an infant. You offered to perform tasks, seeing that blank was very busy. Your newborn assessments were thorough. My only recommendation is to be more gentle with the oral exam. Try to avoid being forceful with getting a finger into the infant's mouth. You gave meds 2 times, doing well with the admin and the 5 rights. So, is this aligned, actionable, or encouraging? Danny, what are you seeing?
Well, I see that it's relatively encouraging. I like the language around try and only recommendation. That's a very gentle kind of way of kind of making that there. And I also see that it is actionable with that recommendation, right? I think it could be a little bit more actionable, however, by perhaps giving an example of what to do or how to do that. That could definitely kind of put that out there.
I also feel like we could be a little more explicitly aligned to the standards here, that we really could highlight what skill the student is working on in this particular instance. So here's another example of feedback.
Blank. I can tell you're really finding your rhythm in clinical. I'm glad you got to do the quote best of both worlds this week with mother slash baby and labor and delivery. I love how you're taking the initiative to ask questions and immerse yourself in both the technical and cultural aspects of care. You're growing into a great nurse, and it's awesome to watch. Dave, what do you think about this example?
So the thing that stands out to me the most is how positive this is
Yeah, this
and
is a
how
great tone.
encouraging it is. The tone is really, really good. We see exclamation point at the end there. The word I love how you're taking the initiative, the
Mm-hmm.
best of both worlds, really finding your rhythm and clinical with the exclamation point there as well. I also thought that there was some specific things going on with the mother baby and labor and delivery and asking questions. I just would like to know a little bit more about what those questions were and
Mm-hmm.
what the students specifically did with mother baby and labor and delivery, and how they could improve in those areas. And so I don't really find it to be actionable, and it's aligned more to a task or to like an area of the hospital
Right.
than it is to any one specific skill.
Right.
If this was talking about like administering medicine, for instance,
Mm-hmm.
like
As we saw in the previous
as we saw in
example.
the previous example, then I would have a much better understanding of what this student would need to do here to get better.
And I see a little hint of that when we talk in this sentence about asking questions and immersing yourself in both the technical and cultural aspects of care. I definitely see hints at AACN essentials and learning objectives and so on and so forth. But again, being a little bit more direct in that language could drive the student more to that improvement point.
Exactly right. Let's look at another one. So, this one says, assessed and provided labor care to a laboring patient, assisted with pain management of nitrous oxide, and then transitioning to epidural placement. Danny, what do you see in terms of alignment, action, and encouragement?
Well, Dave, with this one, to be completely honest, I don't see a whole lot except explaining what the student did. This is not really, I don't think, a good example of actionable feedback or growth-based feedback at all. This is simply just explain it, redescribe, summarizing a task is what's going on here. It's objective. It's very objective. It's very much that camera kind of shooting at the scene, but again, this isn't telling the student anything that they don't already know.
While factual, maybe not actionable feedback for
Yeah.
this one. Let's take a look at our last one.
Great job with a lower acuity patient this week. I'd like to see less focus on schoolwork throughout the day and more involvement with your patient and the unit. Let's focus on practicing assessment skills next time. Keep up the good work. Dave, what stands out to you here?
So again, I'm seeing some positivity, some encouragement. Great job in there. Keep up the good work in there.
Let's focus. I like the tone there.
Yeah, exactly. I do feel like this is a little bit of the sandwich technique with the two compliments on the inside and then the thing you need to work on. And it really seems like this might be a student who is not using their clinical time for clinical work.
Yeah.
And that to me speaks perhaps to professionalism
Yeah.
as a standard, but again, it isn't really at the forefront of the feedback. And the other thing that I would say is that while that is a good note on there, there isn't any actionable feedback that this student can take into another clinical experience and apply going forward. So they might be making similar mistakes in each of their experiences, but not getting the feedback to help them to correct.
Yeah, this one with that middle sentence where that's really where the nugget is that we're really focusing on, that the student. I think also by couching it with that, I'd like to see, we're kind of hinting at the improvement task, the action to take, as opposed to saying explicitly focus less on schoolwork during clinical.
And this is a place where that encouragement actually gets in the way a little bit in there. And if we were aligned with Standard 9 professionalism with
Yes.
AACN, and we said Standard 9 professionalism states that the nurse will perform, I suppose, nursing duties during the nursing shift, and you're not doing that, then we have a clear misalignment from the standard to the assessment, and that might be the reason for a low scoring example.
Exactly. It's continuing to use the language of those objective standards can again empower us as educators sometimes to have the conversation and say it in a way that we need to say it.
Exactly.
So overall, everyone, we've got some key shifts here when we think about feedback and we think about the toolkit really that we're starting to build here for growth-based feedback. Number one, let's think about how we change our language related to poor performance. Again, keeping it away from a right, wrong, keeping it away from a gotcha to a not yet, or next time in clinical, you'll need to, or you should. That can really, again, create that action step. Here
are the things I see you doing well. Here are the areas where I feel like you can improve. That's what I will look for in my next assessment. And then really aligning those things to specific indicator skills and competencies to the learning outcomes of the courses, perhaps, and making sure that those are explicit in the beginning and in the feedback. So students know exactly what they should be doing and what they're looking for, and they don't feel like they have to guess an answer in an adult's head.
And so that those goalposts are never shifting. It's always a consistent idea of this is what good performance looks like at this level in this course, right? And again, it's always clear what they have to do in order to meet those various levels of performance. And when we give feedback to students on current performance, we want to, again, provide that path forward to them with those specific look-fors. Dave, you mentioned this just a second ago. Tell them what we're looking for. Tell them what we're assessing for. Next week, I'll be focused on these domains, these rungs of the rubric, because this is where you're really kind of still falling short.
Yeah, exactly. And that brings us to our last bullet, which is targeted interventions and like really developing areas of mastery rather than trying to just get an A in a class. We start to have the conversation of, oh, how do I perform this competency at a higher level? I've been getting the middle level scoring level this entire time. I really want to improve, dear instructor. How do I do so?
Exactly. And so now, everyone, we're going to do another type of case study. We just kind of did a little mini case study on feedback, and that was sort of one version. But now we're going to look at a little bit of a fuller picture, and we're going to look at some feedback, and then we're going to look at some grades. And we really want you to think about, when you look at this feedback, is this a high, low, or middle scoring student in the clinical experience? And what areas does this feedback really allow the student to improve upon?
So, student feedback number one says blank. I know you've been struggling with time management, but keep working at it. Work life balance is tough. I know you'll figure it out. Your reflection this week is phenomenal. It's clear how thoughtful, observant, and interested you are in both your learning and the care you give. You showed strong clinical judgment by noticing that elevated blood pressure and speaking up, and your initiative and compassion in educating and supporting new patients really stood out. I'm so glad you had such a positive day. You absolutely made a meaningful impact.
This is such great feedback. I really like the tone here that we're seeing.
Yeah. So, a couple things that stood out to me as I go too far in the slides were some specific things that we could talk about here were things like time management.
Mm-hmm.
Okay. Looking at the reflection
Mm-hmm.
and saying that, because that is a skill within the AACN standards, is asking students to reflect
Yep.
along with time management, which also could be elements of professionalism
Professionalism.
or leadership. But again, we could align a little bit more in there. And then that last sentence that we have underlined about showing that clinical judgment and blood pressure
Mm-hmm.
and speaking up is really an actionable thing that the student could continue to do here going forward. I would like to see a little bit on like what might be some areas of improvement, but overall, I would say that this feedback is pretty good. So, Danny, would you think that this is more of a high scoring, a low scoring, or a mid scoring student based on this example?
Well, we're going to get into that in just a few minutes. But again, like, we want to make sure that as we move forward into that thinking, that we want to make sure that it's aligned, right?
Correct.
That scoring is aligned with the feedback. And so, looking at this, I'm leaning more towards the middle and high side of things than, the lower side, based on what we're seeing here in this feedback. Because again, we're not seeing any specific areas
Mhm.
for improvement outside of that first line about struggling with time management.
Exactly. So let's take a minute and allow you to pause and reflect a little bit on student one and say, like, is it a high, middle, or low scoring one in there? Which week of the clinical experience would you expect to find this type of feedback? And then what did you notice about the feedback? What areas could the student improve upon in their next clinical experience? And then we've taken the highlighted lines from the previous example and put them here on the side. So go ahead and pause for just a minute, and we'll join you when you come back.
So welcome back, everybody. Now we're going to take a look at a second student feedback. And again, think through that same thought process as we look forward. You worked with blank today, but wound up doing a lot with me in the morning as blank had a complicated surgical patient. You did 2 assessments on mothers and infant and did the required documentation. Your documentation was complete. You gave medications, provide patients with education on those meds. You sat in with Erin as she provided disc education to a family going home. The afternoon was at a slower pace. You did part of your interview with your patient but did not complete it. I respect your thought that this did not seem the correct time to ask some questions. However, it is all about time management and getting the information from your patient in order to have a thorough assessment. Maybe in the morning, while she was feeling more awake, would have been a better time to get some of the questions asked. It can seem tedious to ask all those questions in one sitting. When admitting a patient, you will find the list of questions asked is long, but again necessary to get all the information needed to create a comprehensive picture. Also, this was an assignment. You can't pick and choose.
So, in looking at this one, I saw these lines were the ones that stood out to me. You did 2 assessments on mothers and infant and did the required documentation. Your documentation was complete. You gave medications, provided patients with education on those meds. The second one, you did part of your interview with the patient but did not complete it. I respect your thought that this did not seem the correct time to ask some questions. However, it's all about time management. The last one is the last line is this was an assessment you can't pick and choose. So Let's take another moment and let's pause and reflect. Do we feel like this student for feedback, sorry, for feedback for student two, is this high scoring or a low scoring or perhaps a middle scoring student? What week of the clinicals would you expect to find this? And then what did you notice about the feedback that could help them to improve in their next clinical experience?
We'll see you when you get back. All right. So now that you've looked at our two students, let's take a look at the scores that the students received and sort of talk through any thoughts that we might have in reflection on these.
So this is student one, just as a reminder coming through, very positive, elevated blood pressure, learning, struggling time management, but overall made a meaningful impact. This student scored an 81.3. In week 5 of clinical experience, scored a does not meet on preparedness and attendance as well as clinical sorry, assignments and reflection was meets or developing in all other indicators.
So again, the thing that really the time management is probably what's in that preparedness and attendance, that comment there around time management. But I don't really recall seeing any feedback around clinical assignments and reflection within the feedback that we saw there. We see that the student has gone down and is does not meet in two areas, but I didn't really see, I saw praise around a lot of that. So again, thinking about, is the feedback really allowing growth in all of the areas that's necessary?
And from the student samples that we saw, I would argue that an 81% actually is a low scoring
Hmm.
examples. Most of the ones that we saw on this assignment were 90% and up.
Yeah.
And so having that positive feedback coming with this 81% doesn't seem to align with what we're looking for in terms of feedback and assessment.
Right. And again, as we were talking about earlier, is there something that the student can do based on the feedback that's being provided? Is there a comment that provides a suggestion about what to do with time management in order to improve that? Again, where was the comment around assessment, assignment, and reflection?
Yeah. Moving on, here's our second student's feedback was a little bit harsher
Mm-hmm.
than the other one. However, this student scored a 90.7. This was week 9 of the clinical experience, so much later in the clinical experience, and then did not meet on the ethical demeanor, teamwork, and engagement strand.
Yeah, but all other indicators were meets or developing. And again, as we think back to what we were hearing with that, we saw again task-based feedback in one area, what the student did do, that they did do well. So that kind of meets those areas of the rubric. But then as well, I am seeing that the feedback towards the end around the questions and the need to complete all of the questions, is that just located within ethical demeanor, teamwork, and engagement, or is that perhaps another indicator that should also be in a does not meet?
Exactly. And the thing again we're noticing in here is such harsh feedback and such a frustrated tone with the other one. This was an assignment you can't pick and choose. Coming back and then getting a 90 on it doesn't seem to be aligned. And then also I worry about giving such a high score to a student who gets such uh, critical feedback in there and how they might improve going forward because it doesn't seem like they have much time left in the program. It seems like this feedback should have come much earlier so we could have mitigated it prior to this happening.
Exactly.
So let's take a minute and pause and reflect. So the list on the right is all of the domains as outlined by AACN. What we would like you to do is think about how you could go back to some of those other bits of feedback and give them feedback in one of these areas.
Hmm.
Maybe it's those interprofessional partnerships or system based practice, but like, what have you seen based on your experiences in the field where you could give that feedback to that student so that they might be able to make a better nursing decision the next time they're in the clinical experience.
Exactly. It's all about kind of giving that feedback that they can use, that is actionable, that guides them forward, as opposed to pointing out what they did poorly or what they did wrong, how to improve that for the next time that they do it, because they are going to do it again.
So take a minute and pause and see if you can't maybe come up with some ways to give actionable, encouraging feedback to one of these students. And welcome back. So, as we close out for today, we really had a couple of ideas that we wanted to bring back into your mind, what we would like you to think about for feedback. First, what made writing actionable feedback difficult for these cases, aside from not knowing the
The
students
students.
and not having seen them in the clinical experience yourself, which I imagine would be huge barriers
Right.
to that sort of feedback. But what is difficult about writing actionable feedback in general?
And we really want to also think about the way that we are designing and talking about assessment so that students are aware of the skills and competencies that are being assessed within that assessment. So they know what they're going to be expected to perform, what they're going to be expected to do, and maybe what feedback they need to be looking at from the previous in order to move forward.
And then finally, what we're really looking at is what's the path forward?
hmm
How does a student move from where they are to the next logical step in their progression? Because it is fine for them to be where they are, they just can't stay there if they're gonna be effective practice ready nurses by the time that they are done in the program. So,
Exactly.
what can we do to move them to the next level of competency? What can we do to make them better overall as nurses?
Exactly. And so, everyone, thank you so much for being with us today. Today, we really explored the concept of growth based feedback, and we wanted to make sure that we understand the big ideas of aligning feedback to standards by using language from the standards, that we use action focused language to really create that path towards mastery, that path towards improvement. And again, thinking about the tone that we're using within our feedback to be encouraging yet realistic, right? To make sure that we're really pointing out where they need to be improving and telling them how to be doing it. We also analyzed and explored some potential revision to look at current feedback language and think about how we can make it more growth based than it currently already might be.
Exactly. So, thank you so much for being with us. We are not done. We have one more video here coming up where we're really going to explore what this looks like holistically,
hmm
how we can put everything together with the idea of aligning standards and action based feedback and really looking at what growth based practices might look at in an individual class as well as in a program overall as we move to more competency based education frameworks.
Yeah, so we'll be talking a lot about assessment in the next session, everybody, and looking at some of the assessment tools that we've been working with. And so we can't wait to see you for our next episode, everyone. Again, we are D2 Educational Consulting, and we'll see you at the next episode.
Thank you.